Why did you decide to come today?
So that I can see my family when I'm clear, or I want to be when I think I'm clear. Because as a mother and a wife, I feel I'm restricted.
It's on the news every night.
The news every night. We listen to the news and we take it all on board. So when we were offered it, we thought we ought to go for it.
Yeah, my name's Andrew Bailey and I'm the secretary at Penwortham Cricket Club. We were approached by Chorley and South Ribble CCG with a view to hiring our function room. When we got the call, we were absolutely delighted just to be a small part in the vaccination programme and just to help our local community. There are a number of things that we can offer. The location, the car parking, but I think the biggest factor of all is we can draw on a membership of over 300 people, and when they said would they be able to help, I knew as a fact that when the call went out, our membership would only too willing to volunteer, and that's been the case.
I've been a member of the club since 1994, and I found out that the cricket club had volunteered to be a vaccination centre, at which point an appeal to all members was posted for helpers, for marshals, which seems to be help assisting people park the cars, finding spaces, asking people to wait in the cars when there's a bit of a queue. Personally, I think it's a good thing to be involved in. Us getting through the pandemic is very much hinged on the success of the vaccine, so obviously I want to help with that wherever I can.
The marshals were excellent. They directed you to where you wanted to go to in the car park. When you came out, they showed you where to go, where to stand, and then when you went into the health centre, there was somebody there to check your temperature, explain what was going to happen. You waited, you went over to the four what we call vaccinators that went in, had the vaccination, and then we were asked to wait for 15 minutes in case there's a reaction. And yes, so it's fine, everything went very well.
Yeah, it's been well run. Well run.
Every credit to the volunteers, because they're absolutely fantastic. Everybody seemed to be doing an excellent job.
Yeah.
They're rolling it out as fast as they possibly can. You know, it's just getting, the volunteers are doing up to now anyway, from what we've seen, there are loads and loads of volunteers.
It was great.
Very, very good.
It was well organised. We met at the gate, sorted out straight away, joined the queue, instructed completely what to do. The injections were great. We sat down for a quarter of an hour. It's so easy.
But I have to say the general atmosphere is very nice.
The vaccine comes in a very small vial with a tiny amount of liquid in the bottom, and it needs 10 inversions before we do anything else with it. So it's a very slow inversion process, that being one inversion. We then have to dilute it with 1.8 millilitres of saline, which needs drawing up and double checking. And then that has to be injected very slowly back into the vial so that you're not agitating the liquid at the bottom. So we slowly inject that back into the vial, and then it's another 10 very slow inversion processes to mix the liquids together. There's 6 doses in each vial, but we're not allowed to waste any doses. So once you've made a vial of 6, you have to make sure that you've got 6 people to give it to. So it's logistically hard work.
So this site is for Ribble Medical Group PCN. So it is St Fillan's Medical Centre in Penwortham and Kingsfold Medical Centre in Penwortham. Fishergate Hill Surgery from Preston. Longton Health Centre and the Beaches from Longton, New Longton Surgery and Lostock Hall Medical Centre. Project about November time actually, it feels like a million years ago now. PCN's a fairly new thing, and as sort of time's gone on we've been building the sort of relationship, but I have to say this has probably been the best team building exercise there could ever have been.
We all GPs wanted to be a part of the vaccination because initially if you look at the national news, it was a program initially thought of to be delivered through super vaccination centres. But we all GPs, including our BMA, which is our organisation, said that we need to be a part of the whole thing. And you can't just exclude us.
It's been incredibly challenging, actually. Not just my bit of it, all of us. We've worked together really well, I think, as the network. We're getting information sent to us by email at sort of 11 o'clock at night by NHS England, which we're expected to enact the following day. Everything keeps changing, everybody's got different views, so trying to sort of keep everybody motivated and on task and moving forward's been quite difficult.
The hardest thing about it has been the short timescales with everything and the fact that the guidance is changing by the hour, the decisions are changing by the hour, and so you have to react so quickly to everything.
Where did all the doctors go when it started?
Well, the practice was shut.
During the first lockdown, we were advised we could suspend a lot of things and concentrate on certain aspects, but this time, all the way through, they've wanted us to try and maintain everything, so it has been a struggle. Individually as a practice, our reception team have been running at 50% capacity since October. We've had a couple of people off on long-term sick. So balancing the practice was difficult anyway, and then with this on top, it's been difficult. We're still trying to maintain the important stuff. The way that the GPs see the patients has changed, whereas they would see every patient that wanted an appointment. Now everything has to be triaged.
I'm proud of our team, how they managed to still see patients on a daily basis, really, as well as doing a lot of video and telephone consultations, as well as attending to patients at COVID vaccination centres. And I think this huge pressure can be underestimated. I'm very passionate about maintaining support for people with chronic disease, and especially the ones with poorly managed chronic disease, to stop them from declining for reasons as the decline would make them more vulnerable to effects of COVID.
I think we all know that we can't do absolutely everything as perfectly as we like to. Maybe we're putting back some of the sort of really routine reviews for patients, but I don't think we're putting anybody at risk doing that. We're still doing all the blood pressures and the asthma management and the really important things.
They did then start doing blood tests. I think at first, after the first shutdown, I think they've learnt a lot since then.
Yeah.
I think we've all learnt a lot since then.
7 practices. We already know each other a little bit, although this is by far the biggest thing we've ever done together. And it has forced us closer together, which has been a really good thing.
Everyone's worked extremely hard, extremely long hours. Everybody's been working evenings, weekends, the rest of it to get up and running. But everybody's sort of just looked at the end goal and thought this is what we need to do and mucked in to do it, really.
I think the best thing was to feel proud being part of an organisation where we could provide this, very needed hope for patients. locally rather than having all patients having to go to a bigger organization like the hospital setting, so it felt very rewarding.
And I think we actually are very satisfied in able to do what we are supposed to do, look after our patients, and that's most important.
It's been really, really positive. Some people have been saying that they were in tears, when they've got the phone call that they were getting this vaccine, because it just means that we're sort of moving forward, hopefully, and it's just giving him that little bit of hope.
But it's been really nice. You've seen some old people come in who are just really grateful to have it. Like, we've had people bring in presents and just really nice, and get all dressed up for it.
This vaccine project seems to be the light at the end of the tunnel for most people, I think, and we're just so lucky to be able to be in the heart of it.
What difference do you think this will make to you personally, and what kind of hopes do you have for the future?
I'm hoping for a damn good summer.
Spring is coming, the daffodils are beginning to grow, so very positive as far as the future is concerned, and hope we can stay well. It's the most important thing at our age.
I just wanted to say to people, this is an amazing opportunity. Don't take it for granted. Like sometimes in the NHS we feel like we are always having to persuade people or negotiate with them when it's best to suit them. This is a one-off opportunity. If you don't take it, you miss it. And please think about yourselves and your loved ones. So have it done, please.
Fantastic.
Okay.
Excellent.